we've talked many times before about the importance of institutions and the importance of institutional trust. Let's recap before we get to the actual public healthcare reckoning we need in our country. Your society, all societies, this is not unique to America, are built on the institutions of that society. The institutions build and train generations of people. The institutions safeguard society against abuse that may come from anywhere, from inside that society or outside society. One great example of this, how it should work in a country. If, for instance, the federal government tries to cover up felonies committed by the president's son so Democrats can win an election. That's bad, okay? I got that, but every country has bad, evil people. Every country's going to have bad, evil leaders. It shouldn't become a mortal wound. You know why it shouldn't? Because the media, for instance, should step up and investigate and expose it and smash that kind of evil and malfeasance. If you had a media institution, that's the kind of thing they would do. Good example, right? Abortion is a great one. I'm super pro-life. But abortion's awful, isn't it? Over 60 million killed. Absolutely awful. Now, how is it that abortion has been able to go on for decades in this country and still goes on today without end? How is it? Because we should have an institution, a religious institution, that steps up universally, every denomination, and boldly cracks down on it. Says, no, this is evil, this is wrong. But we don't have that. Oh, some will. Many won't. Many will say it's okay. Many will come out. I mean, the Pope recently came out and said, well, I mean, if you do the death penalty, then you're not pro-life either. Ridiculous. Institutions. And your medical institutions are a critical part of a society. You have to have them. And the people have to trust them. You have to have some sort of a place people can go where they can rely on the medical advice given to them. And this applies to societies large and small, whether you're a big, prosperous country like ours, or even a tiny Indian tribe in the Americas in the year 1700. You need a medicine man. You need a tent where you can go to, where there's a grizzled old man who will tell you to mix this root with this kind of mud and rub it in your eyes and leave it there until you're blind, and that'll get your cold away. Reliable? I don't know, but the people have to believe it is, otherwise things go crazy. Now, our medical institutions have violated our trust over and over and over again in this country. And so much of this, if you're real young, maybe you think it was always like this. It was not. For most of my life, you trusted your doctor. If you had to go to the ER or the hospital for something, God forbid, you trusted the nurses. You trusted the healthcare institutions. How did they get like they are now? Well, like so many things, it comes back to this man.
First, no matter what you've heard, if you like your doctor or healthcare plan, you can keep it. If you don't have insurance, you'll finally be able to afford insurance. And everyone will have the security and stability that's missing today.
Yeah, Obamacare. Do you want to know why, in large part, you don't trust your doctor anymore? Why your nurse is a demon? Now, we'll get to that part in a moment. You want to know why you go to the doctor's office? Well, you know what, pause. Let me explain what it used to be like. This is for anyone who's younger. If you went to the doctor's office, let's say your back hurts. You wanted to go to the doctor's office. You would sit down in the doctor's office. Your nurse would come in. She'd check your vitals, just like today, blood pressure, all that. And then the doctor, your doctor, who knows you, he would come in and he would sit down with you. And you would sit and you would talk face to face. He'd look you in the eye. He would even discuss things that didn't involve giving prescriptions for things. Hey, your back hurts. Have you been working out? You know, you need to go for a walk, do some sit-ups, get that core strengthened. Your doc and you would sit down and have a conversation. You know what you see now when you go in the doctor's office? The back of his head, the whole time. You know why you see the back of his head? Because he's facing away from you, typing into a computer, clicking on this, clicking. And what did you say? Do you want to know why? Because Obamacare created this thing in medicine where now it's only money. It's only this checkbox and that checkbox and this insurance thing and that pharmaceutical thing. It became completely impersonal. You're just dollars and cents. Oh, you came in, your toe was sore? Here's 25 prescriptions. Come back and see me next week. We'll get you a refill. That's what it became. And of course, it filtered all the way down into the medical institutions that are now fully captured by the communists and training legions of future communists to look after you in your bed while you're laying there sick. I can't wait to be treated like these students from Columbia.
I promise to self-reflect diligently, to confront unconscious prejudices, and to develop the skills, knowledge, and character necessary to engender an inclusive, equitable field of medicine. Let us bow our heads in recognition of the gravity of this oath. We swear to faithfully engage with these ideals and obligations for the ongoing betterment of medicine and humanity.
That's where we're at. And we didn't realize fully where we're at until COVID came. We thought we still had medical institutions we could trust. And then we saw things like this.
You really should, in an indoor setting, a congregate setting, be wearing masks. It's just the appropriate thing to do to protect yourself and your family.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick.
If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections. But it really depends on all of us.
I'm making the personal sacrifices not to infect my parents and my pregnant daughter. I worry about that because then it gives people the option to say, well, if bars and restaurants are open, then I can have 20 people over for Thanksgiving. And so I don't like it to be any number. I like it to be, keep it to your immediate household.
Lie after lie after lie. Remember the closure of your kid's school. Remember the footprints in the grocery store. Remember the local family-owned restaurant that had been there for 40 years that closed its doors and never opened again. Remember, it was all based on the concept of social distancing.
Here's what I want you and America to know. Those projections are definitely sobering, but they don't have to be our reality. If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections.
Social distancing is absolutely critical. And if you can't social distance and you're outside, you must wear a mask.
Other than wearing masks, washing hands, avoiding crowds, and social distancing, what more on a policy level do we in the United States need to be doing?
Well, what we've got to do is make what you just said, Jake, uniform, not spotty. Everybody's got to do it. There's no excuse not to do that right now because we know that can turn things around.
So why did that local mom and pop restaurant close? Why did your child miss graduation? Why did business after business go under? The idea of social distancing. So that, of course, begs the question, where did the medical professionals we're supposed to trust get that idea?
The initial recommendation that the CDC brought to the White House, and I talk about this, was 10 feet. And a political appointee in the White House said, we can't recommend 10 feet. Nobody can measure 10 feet. It's inoperable. Society will shut down. So the compromise was around
evil. We have to get that trust back, especially in our medical institutions. It's too important. We are going to discuss that tonight. Tracy Benz joins us in just a moment. She's one of these health freaks. All that may have made you uncomfortable, but I am right. We'll be back. You know, sometimes you discover that you've been doing something wrong your whole life, and then you feel kind of bad about it. You ever had one of those times about anything? That was me with olive oil. Who thinks about their olive oil? You just always have a bottle. It's always some green bottle sitting by the stove, and whenever you need to cook, you just dab some in there. It's olive oil. No one thinks about it. Your olive oil is old and bland and flavorless. And we don't think about it because we don't know any better. We go to the grocery store, we go down to the grocery aisle. Did you know some of that stuff is years old? Did you know that? Years old. Get a bottle that is fresh from a farm. Change your whole life. Farmfresh246.com will send you a bottle fresh from a farm. They'll send you a free one. $39 bottle, free. You pay $1, help cover the shipping. Farmfresh246.com. Go discover the wonder of good olive oil.
Don't take Tylenol. Don't do it. Don't take Tylenol. Don't take it. And don't give Tylenol to your child. Don't take Tylenol. Don't take it. Don't have your baby take Tylenol. Just don't give it. Don't take Tylenol. Don't take it. Nothing bad can happen. It can only good happen.
It's so immature. It's the Elon Musk part of it that makes me laugh. All right, quit. We're not here to joke. We're here to talk to Tracy. Joining me now, the editor-in-chief of Undercover DC, my friend Tracy Benz. All right, Tracy, a lot was made about the Tylenol during pregnancy thing, and of course, young meatheads like my sons are calling their friends Tylenol Americans now. What is the truth of all this Tylenol stuff?
Well, they found there was a causal link between the use of Tylenol and autism in children when moms took it during pregnancy, or as doctors advise you to do after you shoot your child up with 700 vaccines in their first visit. Give them Tylenol when their immune system reacts and they get a fever. And Tylenol can mess with certain pathways that allow the body to cleanse itself of heavy metals and toxins. So the causal link between Tylenol and autism is actually likely, in my humble opinion, more of the impact of Tylenol stopping the body from being able to, detoxify itself from the assault it had just undergone at the doctor's office.
All right, Tracy, we're going to go ahead and pause here for a moment because I need you in your health freak ways, just like my wife, to explain what you're talking about when you talk about heavy metals and things like that, because morons like me are that, and we think Metallica. That's not what you're discussing. What are you talking about? Heavy metals in your body, cleansing. What is this?
Let's get Metallica to the Super Bowl. That's what I have to say to that. Anyway,
Yes.
So when you are injected with a vaccine, there needs to be something in the vaccine to agitate the body to react to the virus or whatever they're injecting you with, right? Trying to make you immune from. And they use heavy metals to do that. So aluminum, mercury, other metals are in these childhood vaccines that then go into the body. The body says, ooh, what's that? And reacts to it, thereby building an immune response to the thing delivered with the metal, right? So once that's over, what is your body going to do with that? It doesn't want it, but the Tylenol potentially blocks the pathways the body would use to get rid of those metals after the injection. So does that help? Is that better?
That actually helped a great deal. Now I feel so much smarter. I'm going to tell all my friends this now. Okay, let's talk back up more about the Tylenol thing. Tylenol has been publicly lampooned for putting this out publicly years ago that, hey, pregnant women maybe shouldn't take it. So if this is something that has been kind of known for quite some time, why would it take this long to just come out and say it? What was the political motivation, or what? Maybe there was none. Explain this to me.
I think it's money. I really do. I really think it's money. And, the craziest thing I ever saw, a teeny bit off topic, was during the COVID fiasco. There was a pregnant woman on TikTok, and she was about 8 months along, and she was like, I just went and got my COVID shot, but I'm nervous about taking Tylenol. And I'm sitting here like, okay, so you're nervous about taking Tylenol, an over-the-counter medication, but you just got yourself injected with an experimental vaccine that hasn't really been tested on pregnant women at all, and that's okay. People are just not thinking straight. We as women, at least me, when I was pregnant with my kids, I didn't eat, cold cuts because they talked about the danger of those. I stayed away from cats, but when I was sick, I took Tylenol. you just figure because it's available over the counter, it's safe. And then why go around and talk to anybody about the danger of it after that when it's making so much money? There was a huge push to get Tylenol available over the counter, and it's actually not good for you at all. You think you're taking something safe. It's really very bad for everybody, not just pregnant women. So, just heal yourself naturally. Start taking care of your body, putting good food in it, and then don't get sick. It's very simple.
Like Red Lobster. All right, setting that aside, let's talk a little big pharma, because Trump recently talked to the head of Pfizer. Here he was.
Thank you. I'm curious, where are the other companies other than Pfizer? Are you expecting them to come on later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID. He did a fantastic job with a lot of things. He's a leader, and Pfizer is right at the top. It's there. Eli Lilly has been fantastic also, my friend. And they're all coming in over the next week. We're making deals with all of them.
Great.
That made me feel yucky.
I mean, seriously, it's so hard with this administration because he takes 10 steps forward and then takes 5, 6, 7, 8 back. And you just wonder where he's getting information from and what he's paying attention to. The bottom line is this: our country is very, very sick, and a very large majority of our country is dependent upon pharmaceutical medications instead of just being healthy, like I said, and going to Red Lobster. I don't know. I mean, if that's what your bag is, baby, I guess. But if we were healthy, we wouldn't need the pharmaceutical companies. So we're in this hamster wheel of millions of sick Americans dependent on prescription drugs, and drug companies like Pfizer jacking up the cost of those drugs for the people that need them. So should he make a deal with Pfizer and say great things about them? No. But we also have a nation of very, very, very ill individuals who are now dependent upon medicine to live. And so what RFK is doing is trying to tackle that issue, not necessarily embolden the pharmaceutical companies, which is what's been happening for, 50, 60, 70 years now. I hated it. It was terrible.
Tracy, I know this is kind of a chicken or the egg question, but I generally find it fascinating because when you look at how pilled out America is in the studies, it's eye-popping that the wealthiest, most powerful country in the history of the world would be pilled out of its mind. What came first, the unhealth or the pills? Because it's very noticeable.
Probably the unhealth came first, and it really started amping up with, you're going to love this one, truthfully, when moms started going to work instead of staying home to take care of their children, where I think that they should be, in my opinion. Meals went downhill. Everything needed to be convenient. Time was less spent on, taking care of your kids. Not only that, but the vaccine started being mandated, and then we started getting all kinds of disease after that. So food quality went down. Moms were busy outside the house. The whole women's, feminism movement that I wish never happened, happened. And so you have moms not paying attention to their kids, feeding them garbage, which makes them sick. And after a while, we have to play catch up, and we're there. So, and that trickled up, right? So from kids eating McDonald's that used to be cooked a lot better to them becoming adults and doing the same thing over again, we've now got about 2 generations, if not 3, that are very, very unhealthy. And it's really, in my opinion, a lot of it was convenience, and a lot of it was the mandated vaccines for kids entering school.
I knew it was going to be tied to women going into the workforce. I knew it. I blame so many of our problems on exactly that. All right, Tracy, tell me about an inconvenient study. What is this?
So I'm speaking on behalf of myself right now. This is a film that's about a study that was done at Henry Ford Health Center, where they compared unvaccinated to vaccinated children and looked at the differences in health outcomes between the two. And what this study that was not published shows is that, at least in this category, this is the one that got me, vaccinated children were 6 times more likely to have an autoimmune disease than unvaccinated children. Other asthma, eczema, other health issues, 3 times more likely, 4 times more likely in the vaccinated cohort. And that study was never published, and now it was. So this movie is going to go through and show what that study showed and the story behind it. And I'm excited to see it because I think it's something. There have been 6 or 7 other studies like this done and never getting any attention. And this one was from a very well-respected health institution at Henry Ford. And so the results of that should be made public for everybody to see. And you can actually find it on the Senator Ron Johnson's website, because he was the one who brought it forward. And they had a hearing on it a couple weeks ago. It's pretty stunning. And I think if parents saw this, they would at least have a little bit more informed consent when making choices about vaccinating their children.
Okay, so 2 things that I want you to clarify. When you talk about vaccinations of children, we're not talking about COVID. We're talking about the standard vaxes, right? The ones that are thought that every parent's told they have to give to every child. Okay, that's 1.
Yes.
2, why wasn't it published?
I don't know. My opinion? Probably because it showed that there was a 6 times greater chance of your child having an autoimmune disease if they were vaccinated. Just throwing it out there. Because health became politicized, Jesse, instead of health. Because healthcare became politicized. From insurance to illness, healthcare is now politics, and that is absolutely not the way it should be. That's why.
Yeah, it's ugly. It is an inconvenient study. Highly recommend you go see it. Thank you, Tracy. Appreciate it. Dr. Aaron Cariotti is going to join us next. I love chips. Did you know that? I'm a chip freak. When I was a kid, I used to beg my parents to let me have chips. And if they would just give me a bag, which they would never do, I would lay waste to like an entire bag of Doritos or something like that. So I have a real chip problem. I have to be regulated with my chips. But I'm 44 now. And I've come to realize these chips are freaking terrible for you. They just are. There's all sorts of garbage in them, seed oils, you name it, but not massa chips. Finally, a delicious chip that is guilt-free. I know there have been healthy chips before. They're all disgusting. They taste like cardboard. You want one that's just beef tallow, salt, corn, deliciousness? Massa chips, corn chips, potato chips, all kinds of different flavors. You will love them, and you can finally chip out guilt-free. massachips.com/JesseTV.
People in America are not settled with the information that's been given to us right now. So I'm not going to be lining up taking a shot or a vaccination for something that wasn't clear in the first place. And then you all create a shot in miraculous time. It takes years to create vaccination.
Well, it used to take years.
Okay, it used to.
You know how many years were invested in this approach? About 20 years of science to get us to be able to do it.
20 years is not enough. And 9 months is definitely not enough for nobody to be taking no vaccination that you all came up with.
You know how many people have died from COVID-19 in the United States? 600,000 Americans.
Well, the number that you all given that died, that's once again, that's you all's.
I do so miss the patriots who stood up during that time of insanity in this country. One of those patriots joins me now and wrote a book that is near and dear to my heart because it's really what I want for this country. Dr. Aaron Cariotti, author of Making the Cut, How to Heal Modern Medicine. Doctor, I would very much like the trust in our medical institutions to return in this country. Well, I can't treat myself. I'm not a doctor. I don't know anything about this stuff. I'm not a nurse. I need medical institutions I can trust. Now when I walk in my doctor's office, I'm just scornful about everything. I don't trust a single thing.
And you're not alone in that, sadly. And I cite some statistics early in the book showing how trust in physicians has really tanked, obviously took a big hit during COVID, but even prior to COVID, it was being eroded by various factors in medicine that I get into in making the cut. That clip that you just showed is so brilliant, because here you have an ordinary man, not trained in medicine, but exercising his logic and exercising his common sense and saying things that are far more sensible and far more reasonable than the supposed expert who was leading our pandemic response, and who was actually lying, for example, about the mRNA vaccine. So when Fauci said, well, this technology has been in the works for 20 years, what he failed to mention was 20 years of work on mRNA technology had essentially failed to produce safe and effective treatments. So they had been working on mRNA vaccines for 20 years, but they had never gotten past the animal testing phase because they kept running into problems with the technology. And then 9 months of Operation Warp Speed, and everyone is supposed to accept that suddenly, when it became something that was going to be very lucrative and appeared to be very effective at addressing the COVID problem, we were supposed to believe that a technology that had failed to advance for 20 years was now ready for prime time. And anyone who raised their hands, like the man in the video, and asked entirely sensible questions about it, were just told to shut up. You don't know what you're talking about. You're not a virologist. You're not an epidemiologist. This kind of condescension. And what I like to tell people is, yeah, you might not be a virologist. You might not be an epidemiologist, but you are a person with common sense. You're a person with logic and rationality. And you can know, without being a biologist or an expert in infectious disease, that, let's say, a policy that says when you walk into a restaurant and you're standing at the door, you have to wear a mask. But as soon as you sit down in the restaurant, you can take your mask off. This is our infection control recommendation, right? You don't have to be an expert in how viruses work to know that that makes absolutely no sense, and it's ludicrous, and it's theatrical, and it's stupid. And so years of this kind of condescension from the public health, and sadly the medical community as well, has eroded people's trust in medicine. The other thing that happens is, you go to the doctor with your chief complaint, and you want to get some help, and instead of looking at you face to face and carefully examining you and asking questions, in-depth questions precisely about the issue that you came to get help with, you have a doctor staring at a screen who's become a glorified data entry clerk for a medical record system that was not designed for patients, but was designed essentially for data gathering and data analysis. And he's asking you a bunch of questions about, do you wear a helmet when you ride a bike? And do you wear a seatbelt? And are you a smoker? And so on and so forth, which, may be interesting from time to time to get a health screening. But really, this person who's staring at a screen asking you questions that have nothing to do with your chief complaint is not increasing your confidence that you're going to get the help that you need. So I describe in Making the Cut what I call the advent of turnstile medicine, that the primary purpose of medical institutions is no longer first and foremost about health and healing. It's about efficiency. And hospitals and many clinics operate on the principle of efficient people moving, what I call turnstile medicine, right? When you go to Disneyland, the whole engineering of Disneyland is designed to get as many people through as many turnstiles and as many rides, and get you fed, get you toileted, and to move the maximum number of people through the system, right? And medicine now operates more or less on the same principle. And so rather than treating you like a unique individual, they treat you like a sort of widget that's processed by an industrialized healthcare system that's subjected to top-down managerialist control. Managerialism, which has taken over so many aspects of our society, is essentially the ideology that says that a small group of technocrats, a small group of experts, knows best. We saw this during COVID, and is therefore in a position to tell everyone else what to do. And that flows down from the top of our healthcare system to the people on the ground, the doctors and the nurses, who no longer have the appropriate discretionary latitude to tailor treatments to individual patients, right? They're reduced to checking boxes. They're reduced to treating every hip replacement exactly the same. And in fact, the bundled payment system of the Affordable Care Act dictates that hospitals treat every hip replacement exactly the same. So if your hospital is extended because you have a surgical complication, the hospital is actually losing money on you. And the hospital begins to resent you because you're not behaving according to the principle of efficient people moving. Hospital administrators love the term throughput. Get people in, get them processed, and get them out as soon as possible. And patients start feeling like manufactured products rather than human beings with a unique history and unique problems and unique fears and worries about their illness that need to be attended to by actual human beings that care for them. So the central theme of making the cut is, how do we restore the doctor-patient relationship? The relationship between someone who's vulnerable because they're suffering from illness and someone who professes to use all their knowledge and skills for the purpose of health and healing, not for the purpose of data gathering, not for the purpose of efficient people moving, not for the purpose of a needle in every arm so that they can get their bonus payment because 85% of their patient population is vaccinated, or any other external thing that's dictating care. And we need to move to a much more decentralized healthcare system where obviously the healthcare system needs some regulation, but things have gone so far in the direction of overregulation that it constrains the ability of conscientious doctors and nurses to provide the kind of care that their patients really need. And patients feel that. I think many people experience it. Maybe they can't articulate it. Maybe they don't know why, but they just leave the clinic experience. They leave the hospital experience feeling like something very fundamental was missing there. And I'm actually not getting any better. I'm not healing. We have, as everyone knows now or should know, from the MAHA movement, we have this chronic disease epidemic that's undeniable. These statistics don't lie. We have a very serious problem with chronic illness in this country, and medicine has not been very effective at dealing with it. Medicine's still very good at certain things. If, God forbid, Jesse, you get hit by a truck tomorrow, go to the emergency room, have the trauma surgeons patch you back together. Medicine is very good at dealing with acute trauma, at dealing with acute illness. We're not very effective at dealing with chronic illness, at helping people maintain a healthy lifestyle, at sort of long-term projects of health and healing. And so this book is my attempt to explain what's going on in the House of Medicine, how medicine itself got sick, and also try to offer some realistic and constructive solutions regarding how we might be able to move forward.
Yeah, that's why we need it so much. I'm so glad you wrote it. Doctor, thank you so much for joining us. I appreciate you. Please come back soon. It was wonderful. That's the body portion of it. Let's talk about the mental health portion of it. It's undeniable. We have a mental health disaster in our country. Let's get to the bottom of that next. You know why there's a testosterone clinic on every single corner in your town or city? Every corner. You see them everywhere, right? Low T clinic this or low T clinic that. It's born out of necessity. The United States of America has synthetic estrogens in its water supply, lots of them. The result of this is a 50% drop in our testosterone in the last 50 years. That is the end of civilization if it continues. It's that big of a deal. And men feel it. That's why these low T clinics pop up. But that's terrible for you. Handle the problem naturally with natural herbal supplements. Start a male vitality stack from chalk today and watch your T levels jack through the roof without jamming a needle in your arm. I've been on one over 3 years. Natural herbal supplements. You go to chalk.com/JesseTV for a gigantic discount. Start today.
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. You know, these kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. People, kids, my classmates, other people, would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting. So there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time.
For the first time. That is quite an admission. Joining me now, Dr. Joseph Witt-Doering, CEO and Medical Director of Taper Clinic and host of Side Effects with Dr. Joseph. Doctor, okay, so we'll set aside that we're doing these studies for the first time. What he says is noticeably true. We've always had guns. Now we have psychos walking into schools and churches, murdering people before they blow their heads off. And it's unbelievably terrible. We need to get to the root of the problem. What is it?
So when we look at what is causing mass shootings, I think there is, surely there's an element of mass contagion going on. But what Bobby says about the psychiatric drugs being involved is completely true. If you listen to the media these days, they will say that you're a conspiracy theorist if you even suggest that these drugs can do such a thing. But it's hiding in plain sight. I mean, if you look at the drug labels, like you mentioned, for SSRIs, it already says that they can cause aggression and hostility. It already says that they can make people who are not suicidal. If you look at the side effects for stimulant medications, in the warnings and precautions, which is one of the areas on the drug which has the most important risk, it already lists hostility and aggression. If you look at the drug Abilify, a popular antipsychotic drug given to people, it already lists homicidal ideation in there. These side effects are there because doctors and the pharmaceutical industry have known for a long time that these drugs, in rare instances, I want to say that, these are not the common effects, these are the paradoxical effects from the medications, that in rare instances, they can make some people more aggressive. And so, it's like, imagine you have like 10 people smoking some cannabis, right? 9 people, they're sitting around giggling, having a good time, and one person is getting paranoid. The same thing happens with psychiatric medications. Some people, just for reasons that we don't understand, respond in a negative way, and they can become more aggressive. And there's actually been, and the media never talks about this, there's actually been several cases out there which have gone to the courts where judges and jurors have found that these drugs have been involved in suicides and also mass homicide.
Doctor, do we believe that it has something to do, I know we don't know yet, as you just pointed out, but does this have something to do with your mental state going into the use of it? Or is it genetic? What is it that has, as you said, 9 people can take it and maybe they're a little lethargic and the last one turns into a demon who murders Catholic school kids? How in the world can the results be so different?
Yeah, and that you're putting your finger on something that's really unique, that these drugs can have a spectrum effect, right? Let's say, for instance, you already have someone who is harboring some kind of homicidal thoughts. You put them on a medication that's disinhibiting, a medication that is blunting their emotions. And this is what a lot of these medications do, especially things like SSRIs. They may be more likely to act on pre-existing thoughts. However, what I do want to say, and this is where it's going to sound like kind of almost demonic, these medications can make some people so psychotic that even people who never had a hint of violence, they can actually go and do terrible things. You know, 2 cases come to mind. And this is a little bit dark, but I think it's important to talk about this topic. You know, there was the case of Donald Shell in Wyoming in the 90s. Now, Donald Shell had been exposed to, I think it was Prozac. It's an SSRI medication, and he had a very bad reaction to it. He actually became more agitated. He went and saw another doctor who put him on Paxil, which is actually another SSRI in the same class as Prozac. Now, normally this should never happen. You know, if you have a bad reaction to a drug in a class, a doctor doesn't give you a drug in that same class later on, but because of poor record keeping and, you know, bad communication, that happened. Now, within a week, Don Shell killed his wife, his daughter, and his granddaughter, and then he killed himself. This went before a jury, and they found that SmithKline was 80% responsible for what had happened. This resulted in $1 million verdict. And that's just one case. You know, and another case was, and this is these are some of the most heartbreaking stories you'll ever hear. Another very well-known case was David Carmichael. This was a Canadian man, never had a history of violence, loving father, all of those things. He actually took a medication, Paxil again, I believe, and within a week, he killed his son by accident. He became completely psychotic and delusional. I think his son had a seizure disorder, and so that was it. That was like the nut. His son had a seizure disorder, but when he took the medication, he started to believe that his son was going to die, and that the most compassionate thing to do would be to put him out of his misery. He woke up in jail several weeks later, realizing what he had done, and now he speaks about this all over the country. And so, yes, I do think you can have like a spectrum issue where someone who might be a little bit on edge already can get pushed into it. But I also think in some people who are very unlucky, it can be entirely the drug and the manic type psychosis reaction that pushes them into this.
Gosh, that is scary stuff. Doctor, thank you so much for giving us a few minutes tonight. Thank you. I really, really appreciate it. Thank you. We're going to have him back. This is fascinating and it's scary, but it's something we have to talk about because it's everywhere. Maybe you're on them. Okay, let's talk about it. Let's continue to have these conversations. All right, I have some final thoughts. We'll get to those next. All right, so we do these kinds of specials a lot. We put up short clips a lot. The one-stop shop for all of these things is our YouTube channel. All you have to do is pick up your phone, scan that little thing on there. It's free. It's all free. Just go subscribe at Jesse Kelly DC on YouTube, and you can get this and a whole lot more. All right? All right, we'll do it again. We need to have a public reckoning for our medical institutions. And I should say, it is beginning. We do have good people there. Dr. J, Dr. Marnie McCary. We have good people there, but we have to have this reckoning because we have to have medical institutions we can trust. I can't be my own doctor. You can't be your own doctor. Even doctors aren't their own doctor. We need help. We need institutions like this, and ours have been destroyed and taken from us. We have to take whatever steps are necessary in order to get those institutions back. I'm not going to let this go, and neither should you. All right, we'll do it again.